And then importantly, data as the tool for making and tracking progress. So with full disclosure that this is a hard needle to move, I think we've asked practices, we're actually in a second round of Choosing Wisely right now with provider groups in 2 communities and asking them to look at changes over time with a goal of reducing antibiotic use for acute bronchitis as well as imaging for low back pain. So each one of these sets of lines, dark blue, purple, and light blue, is one provider system. The steady line is the goal, what we're trying to reduce to. And you can see 3 examples. The first one looked like it started out well, and then it's, bounced up a little bit. The middle one has made steady progress. And the third one actually started out pretty good and has been sort of hugging that goal line. Go ahead. But giving that kind of, tracking that and giving that feedback to providers. You can also see here for low back pain, you want to see this one going up. Actually, the HEDIS measure is the number who didn't get testing. So you do want to see that going up over time, and they are making progress there. As part of that, I think it's also important to think about, well, how do you get that data? And it's, I think, an important distinction is what we're really looking at is overall utilization for these numbers. So you're not trying to say for every individual patient, did they make the right decision? But overall, for patients with low back pain, our providers in the practice appropriately not using imaging in the first 6 weeks, or not using antibiotics. And that's a distinction I think sometimes when you're working with provider groups, they'll often say, well, we need individual clinician discretion, and some patients it is appropriate. And you say, absolutely yes, but we're looking at overall utilization patterns. Go ahead. And really thinking about how to use the electronic health record as part of that. I will say, well, I think there are lots of opportunities, and I've certainly heard some great progress from other provider groups around the country. This isn't an area where providers in our state have really spent a lot of energy, but one could, in theory, embed Choosing Wisely focus areas, prompts, clinical decision support functions in the EHR, create links to Choosing Wisely materials. And I think they have been using, particularly in our current pilot, using the EHR for tracking utilization measures, recognizing that particularly for the first 2, embedding clinical decision support prompts or patient info sheets is a real challenge, as we know, to engage the major EHR vendors.